Great, thanks Pam. Okay, so let's get cracking. So, firstly, welcome everyone to the introduction to the National Clinical Terminology Service, or NCTS. I'm Luke Swindale, and I've been working as a software developer over the past 10 years at the agency, and prior to that known as NETA. Primarily, I've been working in a supporting role, working in a role supporting and developing clinical terminology and the tooling around it. Today, I'll be walking you all through what the NCTS is, what it has to offer, and where you might start in considering how to integrate with it. To kick off, I'll just dive straight in and give a little bit of a background on clinical terminology itself, and then how we've now arrived at the NCTS. So, why a structured clinical terminology? In short, interoperability and unambiguous identification of common concepts despite disparate languages, conventions, and software systems. Having a structured vocab allows healthcare providers at each level to record and recognise concepts such as disorders, finding sites, prescriptions, and dispensing options. By modelling a structured terminology, we can enable decision support and build smarter systems. In the world of medicines, an example may be the ability for a dispensing system to identify equivalent medications or flag potential complications with drug interactions or dangerously compounding ingredients. Adopting a structured clinical terminology also facilitates consistent indexing and classification. This can help to identify and reduce duplicate concepts that would otherwise lead. Sorry, one moment. That would otherwise lead to ambiguous selection of redundant codes. One such terminology is SNOMED CT. This has been the terminology standard used by the agency to author clinical concepts and released as the SNOMED CT AU edition, or SCTAU for short. So what is SCTAU? SCTAU is a SNOMED CT extension. SNOMED CT itself is a comprehensive clinical terminology that is quite mature. It's evolved over the past 10 plus years. It incorporates the ability to record synonymous terms for a concept and flagging the preferred term within each particular dialect. SNOMED CT is extensible. It supports extensions of the international core terminology, an example of which is the SCTAU edition that many of you are quite familiar with. SCTAU makes use of modules, which may be considered as somewhat similar to namespacing within the programming world, one module being the Australian Medicines Terminology, or AMT. So, model taxonomies and defining attributes mean that SCTAU is machine processable, is classifiable, and importantly, contains far more information than would otherwise be gleaned from a set of IDs and terms. Being a SNOMED CT terminology, we've traditionally released SCTAU and AMT in SNOMED's RF2 distribution format. Now, having spruiked SNOMED CT, I've got to admit that it must be acknowledged that there is a lot of difficulty in managing and consuming that complexity. This has often been a common criticism of the terminologies we've historically released and has been flagged as one of the barriers to adoption. So, with the initiation of the NCTS, we thought, well, let's consider all those adoption barriers and engage with our stakeholders. We thought, what are the biggest bugbears of those trying to use our products, and how can we better drive their consistent and meaningful use? Another key requirement was to help deliver a solution that better supports more granular localization of content. SNOMED CT doesn't necessarily achieve this on its own, and is often considered overkill for many use cases. Moreover, it's generally authored and maintained at a national and international level instead of a jurisdictional level. So As I mentioned, we kicked off by working with jurisdictions to develop a workable business case, which is summarised in this slide. The main thrust of the exercise is pretty well captured in the vision statement, being to improve the delivery of healthcare through the realisation of the benefits of clinical terminology by simplifying its adoption and meaningful use. And working together, we tried our damnedest to identify the needs of our users and how we could deliver them the highest value product without being too authoritative and force a system on users that they aren't really interested in. To help deliver on this, to help deliver on the most important use cases for the NCTS, we were then tasked with identifying the most critical subsystems and where their boundaries lie. The most visible part of the NCTS and useful for someone starting out is the portal itself. It's a centralised hub which allows users and organisations to self-manage their registrations, licences and credentials. It's a source of specification documents and exemplar resources. The portal provides links to download the SNOMED CT terminology files as well as TSB versions. It also provides a listing of value sets contained within the NTS and documentation about their use. The portal offers a content request facility as well. That's for making formal submissions of content to be included within the national terminology. Okay, so the next core service in the NCTS is the National Terminology Server, which I'll refer to as the NTS. Unfortunately, this diagram doesn't really do it justice in emphasising its importance within the NCTS because it really is a keystone for the service. To deliver the NTS as a flagship service, we've partnered with CSIRO, using their Ontoserver product. This was an obvious choice for providing a fire terminology server that could adequately meet the needs of our users. Two other key aspects of the NCTS were clearly distribution and centralisation of terminology resources. We wanted to be able to facilitate the integration of our user systems with our distribution channel and also remove the need for them to pull down the entire terminology and work from there. Instead, we're now providing a service that could be queried just for the content that's needed or allowed to automatically syndicate content. The remaining Ontoserver, Snapper and syndication subsystems are all available to help deliver on the rest of our requirements. Okay, so let's now dive into the NTS and what you should expect to get from it. Currently, the NTS is populated from the SCTAU RF2 release files, letting Ontoserver absorb the implied complexity around processing those. So whatever content you may already use from our RF2 distribution should now be available and accessible via FHIR requests. And for those that aren't familiar, FHIR, or Fast Healthcare Interoperability Resources, is covered in our previous Introduction to FHIR webinar, which should be accessible online shortly. You may be wondering how this translates from RF2 to FHIR resources. So all the SNOMED CT content is now available as an implicit SCT code system within FHIR. Some high-level examples of the concepts contained in the SCT code system are things like body structures, clinical findings, AMT model concepts, etc. The RF2 reference sets may now be queried as implicit value sets within FHIR, although it should be noted that for now at least, these are all treated as simple type membership ref sets and without additional attribute values or concrete domains. Okay, so the RF2 reference sets are still available as implicit value sets. A full list of those is available on the NCTS website under the Access SNOMED CT section. However, the sorts of value sets you can expect to find are things like fracture finding, reference set, imaging, all the AMT ones, like medicinal product unit of use reference sets. We'd had some questions in the previous webinar about where we could find information on what value sets were available and what they look like. So jumping onto the portal and finding that section is a good place to start, because it'll give you all the metadata about what's contained within them. The NTS doesn't currently provide any explicit concept maps, so nothing beyond the SCT at the moment. However, the inclusion of additional explicit code systems would open the door for their inclusion. This would allow the mapping of equivalent concepts to be mapped between two different code systems. The basic fire terminology services webinar that John Grimes will be running on Thursday will dig deeper into some of those concepts. Okay. So in the previous slide, I mentioned that the NTS contains the implicit SCT code system. However, there are many other code systems out there with national significance that may actually be good candidates for inclusion in the NTS. PBS and LOINC may be obvious inclusions. If we were to include, say, the PBS code system, we'd have the opportunity to start authoring concept maps that would provide a direct mapping between AMT medications and their PBS counterparts. Beyond that, really, it's whatever else you can think of. So I'd encourage you to contact PAN or the help desk about this, should you have any suggestions that you think would be good candidates for the NTS. As a guide, though, we should carefully consider the scope of what we put into the NTS and ensure that it truly is handling code systems that are relevant to a national audience. And more focused code systems may actually be more appropriate to a jurisdiction or vendor. And I'll talk about that in a little bit in the context of a conformant terminology server application shortly. So we'll now go over the APIs that are available within the NCTS, since this is likely what you're all interested in, really. The NTS Fire API is really the bulk of what's on offer, but I'll quickly go over the auth service, the authentication service first, so we can focus on the important stuff. Basically, the authentication endpoint will allow a client to request an access token that will be required for subsequent authenticated requests, and it's pretty much as simple as that. So, the Fire API. As I previously mentioned, the NTS offers a Fire API, allowing clients to query the clinical terminology directly. I'll walk through a couple of examples of that in a moment to give you an idea of what can be achieved. And I'll be doing that using the Postman application. Our API conforms with the STU3 version of the Fire standard, which can be found at the hl7.org website. It sits on top of Ontoserver, however it should be noted that it is configured in a read-only manner. In the local deployment slides, I'll discuss how local or jurisdictional specific content may be authored in downstream terminology servers. And so finally, we have the syndication API. That's available to query available terminology publications and resources via an Atom XML feed. Primarily, the syndication feed is for use with conformant syndication servers, of which Ontoserver supports and will syndicate with the national syndication service to pull down updated binary indexes, and they'll be made available as releases are on the NCTS. The syndication feed also provides means of linking to the SNOMED CT RF2 bundles that we've traditionally released, and they're available in their various formats, being snapshot, full, delta, or all combined. Okay, so now, so I previously described the NTS API and how it conforms with the STU3 version of Fire. I'll now go through and explore some of the more core parts of that API. If you wanted to explore these further yourself, I'd recommend downloading the postband collection that's currently available on the NCTS website. You'll just need to download the collection files and additionally create some client credentials, and that's available to do within the My Profile section of the NCTS. So some of the key operations that you'll want to perform are shown on this slide. I'll start with the capability statement. So in the previous Introduction to FIRE webinar, Angus mentioned the metadata resource. This is now referred to as the capability statement. The capability statement is basically, it's a machine processable definition of metadata relating to the capabilities of a FIRE server. It may be used to negotiate available operations that it will allow the client to perform. It outlines the FIRE version it conforms to, and in the case of the NTS, whether it supports read-only operation. So probably one of the core operations you'll want to use, certainly the most frequently hit one within the NTS, is a value set expansion. The value set expand operation provides an expansion of codes that are contained by a value set. So that means basically when you expand a particular value set, you get back a listing of concepts and their descriptions that are contained within that subset of data. A value set may also contain codes from one or more code system, although this is not currently the case in the NTS, considering we've only got one. For now, NTS value sets are implicitly a FIRE representation of the SNOMED CT reference sets. As a user, it is also possible to dynamically construct your own composed value sets. To do this requires posting a definition of what you want included in a resulting value set and let the terminology server do all the hard work. If any of you have some more bespoke requirements of data sets you'd need, it would be worthwhile trying to clearly describe those before next week's Connectathon, where one of us or the CSIRO team can help construct the composition that best suits your need. And the last one I'll go into here is the code system lookup. So, not surprisingly, the code system lookup operation allows you to look up a particular code within a code system. But what does that actually mean? The operation itself takes two parameters, a code and a system. In response to that lookup, the client is presented with the latest code system version it's contained within. Additionally, the lookup provides a list of synonyms and their language designation. It returns the fully specified name for a concept. It also returns the list of parent concepts, the effective time of that concept, and more. Again, the postband collection on the NCTS website provides an example query to help guide your implementation. So at this point, no doubt you're probably sick of listening to me ramble, so it'd probably be a good time to start walking through a couple of simple examples. These examples are pulled directly from those on the NCTS website, so I strongly encourage you to download those. As I previously mentioned, one of the first things you'll want to do is request an authentication token. The example shown here is configured to supply the client credentials you would have already requested via the NCTS My Profile page. The token would then be provided in subsequent requests, and the token you would then provide in subsequent requests can be found in the access token attribute of the return JSON object. In the Postman example, it's actually configured to store that attribute value in a variable named auth token, and that's as a convenience for subsequent examples. So now that we've got our auth token, we can use that to request a value set expansion. In the example provided here, we're requesting the expansion of an implicit SCT value set. More specifically, we're expanding the laterality reference set, as you can see, hopefully, in the results there. This operation can be performed using a HTTP GET. However, the example here shows us performing an HTTP POST, providing the value set identifier as a parameter in the request body. And finally, we're provided with the set of active members of that value set in the response. You can see on the right there. So as a third and final example, we're requesting the syndication feed from the National Syndication Service. The syndication feed doesn't actually require any authentication, so for this one we won't include that authentication token. The feed itself is an XML-based format, so if you wanted to have a look at it, there are plenty of applications available to help with its rendering. Currently it returns two types of resources advertised in the feed, those being the Ontoserver binary indexes. They're used to update local Ontoserver instances. It also includes SNOMED CT RF2 bundles. That's to assist with clients to automate receiving SNOMED CT-based terminology resources. So I've already mentioned concept maps and how they're a way of mapping equivalence between code systems, which begs the question, how do I create a concept map? Probably the easiest way to create a concept map is using CSIRO's Snapper tool. Snapper will connect to a compatible file server, including the NTS. However, I should point out that there are some limitations in using it with the NTS. The NTS is read-only, so you won't be able to save a concept map back to the server. Also, the NTS only contains one code system at this time, so this adds some complexity to how a user of Snapper would actually manage the target code system. Configuring Snapper to point at a localized CTSA deployment would negate some of those problems though. The NCTS does actually host an instance of Snapper at healthterminologies.gov.au/FIREauthoring. And I think that link's available on the last slide. However, vendors and jurisdictions are also encouraged to install Snapper themselves, if they'd like, within their own network. And there is also an instance hosted by CSIRO, which I'll give the link to later. So this slide shows the mapping editor within Snapper. It has a drag and drop interface, allowing an author to drop search results from that right-hand side into the target of individual mapping records. The diagram at the bottom helps identify other relationships that the target is involved in. There's actually quite a bit more to Snapper that I won't go into here, but please jump onto the NCTS portal and have a play with it anyway. You should be able to find the link to Snapper under the tools section of the site. Alternatively, if you can flag one of us down at next week's Connectathon, and we'll be happy to give you a walkthrough on how to use that. Okay, so as I'd mentioned earlier, the distribution of terminology was a key consideration in defining the NCTS. We understand the difficulty in managing a flat file structure and are definitely aware of the benefits provided from using a dedicated terminology server. Yeah, it's for this reason we engaged in a partnership with CSIRO and finalised on their Ontoserver product. Beyond the NTS itself, we also considered how we could leverage this partnership to help our clients realise those same benefits. And thankfully, CSIRO offer a free Ontoserver sub-license for use within or for the benefit of Australia. Contacting either CSIRO or the help desk email is probably the best place to go for more information on the licensing side of things. With that said, you're probably still wondering how and why would I deploy an Ontoserver within my system? The question really does depend on your particular need. So there are a number of topologies you might consider, remembering that the NTS itself is read-only. For simple use and clinical research, querying the NTS directly may actually be completely reasonable. However, for anything more more complex than that, you'll probably want to deploy your own Ontoserver and syndicate content from the NCTS. Ontoserver, I think by default, is actually configured to automatically do this for you, but we've got full instructions on how to actually configure that. Furthermore, if you're a large jurisdiction, you may want to deploy a top-level master server that other localized deployments can push content to. Alternatively, you may want an intermediate server to quarantine releases and allow mapping to local code systems before pushing out to other installations. To help guide your design decisions, I'd recommend that you have a read through the deployment section of the NCTS Guide for Implementers. That can be found on the NCTS website. It would be a really good idea to understand some of your options prior to attending the upcoming Connectathon, as you'll have the opportunity to discuss further with developers from the agency and CSIRO as well. Okay. So in this slide here, we can see a couple of example deployment scenarios. It shows how you may want to deploy your own terminology server or not. At the very top of the diagram, you'll see the national infrastructure shown as the originating source of our national clinical terminology. At the top right, you can see jurisdiction B working directly with the NTS, possibly using something like Snapper to query their own custom data sets. On the left, you can see where the software vendor has developed their own Ontoserver, has deployed their own Ontoserver instance for the purpose of regularly syndicating terminology releases down, and that can be incorporated into their own product build processes, using their own clinical systems, receiving updates in whatever manner is most appropriate for those. So those first two examples are fairly trivial, really. They're fairly simple. For a larger jurisdiction, however, you may want to take your design to the next level. So, so what you can see here is for jurisdiction A, they have their own master terminology server, which syndicates content from the national server. Just off to the right-hand side there, you might have a team developing concept maps between something like AMT substances, for example, and their equivalent in their own code system, and then saving them back to that Ontoserver instance. Those concept maps may be authored using Snapper or some other Fire-based mapping tool. If you move down on that diagram, we can see a more localized instance which syndicates content from the jurisdictional master, including those concept maps which have been authored. This instance may be used directly by a clinical system within one of their business units, generating coded clinical documents that might feed into an EMR system. While what I've described there that sort of setup might sound a little complicated on the face of it, it's actually a reasonably easy topology to work with, and probably offers the biggest bang for buck in getting a terminology server into a reasonable size system fairly quickly. Again, the developer's guide document provides explicit instructions on how you'd achieve some of those deployments. Okay, so I've talked about Ontoserver. So more generally, Ontoserver is currently our recommended choice when deploying your own terminology server, if you choose to do so. It's a tool that we believe in because it supports complex querying, subsumption, closure tables, ECL, which is SNOMED CT expression constraint language. In its default writable mode, Ontoserver supports search, create, read, update, and delete operations on each of the core resource types, those being code system, value set, and concept map. And obviously, it's also configured to be able to syndicate with the national syndication server but most importantly, it works for us, so we have to recommend it. So having said all that, you're more than welcome to use another FHIR-based terminology server that can syndicate content from the NCTS, but I'd strongly recommend Ontoserver. So that pretty much wraps up most of the technical overview. With the Connectathon a week away, now would be actually a good time to get started with some of the reading and prep work. I'd make sure you have a look at the guide for implementers that I've mentioned a couple of times, and then any other relevant specifications. Some of the FHIR specs would be a good start if you haven't had anything to do with FHIR before. On the NCTS, you can also locate the SCTAU Technical Implementation Guide. That's worth a look at to get an idea of the semantics of our clinical terminology and advice on working with the RF2 files, should you wish to do so. If you think you'd benefit from a local Ontoserver installation, it'd be worth looking into that to see if you can generate any questions that we can help you with next week. Also, try to jump on to Snapper and have a play with that if you're interested in developing your own concept maps. I'll also point out that CSIRO has their own Snapper instance, which is available for you all to have a look at. I will note, though, that CSIRO's installation is writable, or sorry, the FHIR server that it's configured for by default is writable. So please make sure that you're not using real data. So you don't want to be posting back any identifiable data that might be accessible to others. So now that I've covered that off, I guess we can quickly speak to what we've also been working on and give you a hint at any future development. I think the obvious one would have to be additional code systems. So I believe there is some plans, but nothing's been kicked off yet for development, or there's certainly, there are plans to start expanding our code system offerings, and beyond that, some explicit concept maps. Some of our clinicians are currently working on some explicit value set FHIR resources to support our specifications. So we should expect to see some of these made available in the not too distant future. But you're probably wanting to hear about something that's actually interesting, like code. Although I'm probably biased on that. We've recently been working on a product called MedServe. MedServe is an online reference tool used for exploring the Australian medicines terminology and talks entirely to a FHIR terminology server as its back-end component. It's interesting to us, the developers, as it started out as a learning exercise and has proven to develop into a useful resource for others working with the AMT. If you're interested in having a look at MedServe, I'd jump onto medserve.online and have a play there. So I think I've covered off most of the material I wanted to go through.
Great. All right, so I think we'll just end there. So thank you very much for attending this webinar. And we'll look forward to either seeing you at the next webinar, which is on Thursday, or the Connectathon, which is next week. Thank you very much. See you all.
Thanks, Ben.
Thank you.